Hello everyone, my name is Vincent Mariah and this is my research proposal around examining the impact of mental health interventions on patient recovery and nurse satisfaction. So a little bit of an introduction. Mental health includes our emotions, psychological and social well-being. It affects how we think, feel, act, and helps determine how we handle stress, relate to others, and make choices. So it is very important in our lives and in our careers. The mental well-being of both patients and healthcare providers is crucial in shaping healthcare outcomes. In the nursing field, the mental health of patients and the psychological resilience of the nurses is closely connected, significantly influencing the quality of care. If the nurse is better with their mental health, it can help influence the client in a more positive way. Research has established that mental health interventions can establish recovery rates and improve patient satisfaction. However, mental health remains an underemphasized aspect of patient care and is often overshadowed by physical health considerations. And so in research by Harimi et al., it indicates that the patients were suffering from chronic conditions such as vision impairment. They frequently experienced anxiety and depression to go with that. And the importance of this. So nurses work in extremely high pressure environments and frequently face significant stressors. In research done by Huang et al., they found a compelling link between nurses' mental health and patient satisfaction, which demonstrated that when nurses experience better mental health, it translates into improved patient care and satisfaction. That just shows that it's very integral for nurses and healthcare workers in general to be showing good mental health. So my proposal seeks to investigate the dual benefits of mental health interventions for both patients and nurses. We need to understand that addressing mental health on both fronts can lead to improvements in healthcare delivery overall. And then over here, this chart done by Frontline Nurse Mental Health and Wellbeing Survey showed that nurses are actually very unlikely to seek support at work for their mental health. They're somewhat more likely to search outside, which is good, seeking other professional help, but they are not likely to seek help at work if they are struggling. So for some background and rationale behind why we're seeking to research this, historically, mental health has been an overlooked element of patient care, with many healthcare systems focusing on physical health. They focus on the physical ailment. Existing literature emphasizes the necessity of addressing mental health issues to enhance patient recovery, yet many systems continue to just treat the physical ailments in isolation. Again, that same research done showed that in level 3 hospitals in China, nurses who were receiving mental health support not only reported lower levels of burnout, but also provided higher quality care to the patients overall, and that led to improved outcomes and satisfaction. Despite these findings, there is a gap in literature regarding the integration of mental health care within nursing practices. So my proposal aims to address the identified gaps by implementing an evidence-based intervention focused on enhancing mental health outcomes for both patients and nurses. This approach, as I said before, could lead to improved patient care, decreased burnout, and just better quality healthcare. And this chart over here, also done by Frontline Nurse Mental Health and Wellbeing Survey, done in 2022, showed some feelings that nurses were having during the pandemic. Many were experiencing burnout. Many felt that their physical health declined. They felt depressed. But one of the most shocking stats here is that 1 in 10 nurses actually experienced suicidal thoughts as a result of the pandemic, which goes to show how damaged their mental health was. And here are some objectives that go towards this research project. Objective 1 is to enhance patient outcomes. You can incorporate routine mental health assessments and interventions into nursing care, and the effectiveness can be measured by tracking recovery times and satisfaction levels pre and post intervention. Objective 2, decreasing nurse burnout and increasing job satisfaction. through provision of targeted mental health support, evaluated by using a standardized burnout and satisfaction survey. Obviously, that one is based around surveys. Same with the other one. It makes it not the most accurate thing, but it's the best way that we can track satisfaction. Assessing the effectiveness of integrated mental health interventions for both patients and nurses on improving patient satisfaction and nurse job performances, which kind of ties back into the first two. And then evaluating the cost effectiveness of implementing mental health strategies within nursing practice over a 6-month period, considering the impacts of reduced nurse turnover and improved patient outcomes. So this one kind of goes towards the cost. Keeping a nurse is much more cost effective than having to train a new nurse, as well as having better patient outcomes means they don't have to stay as long, and you can hopefully expect not to see this patient again for an amount of time, or hopefully ever. Hopefully they're okay. Some methods that go into this study. This project utilizes a quasi-experimental design to evaluate the effects of mental health interventions on patient outcomes and nurse satisfaction. This approach is appropriate towards a real-world setting where randomization is often impractical. By comparing outcomes before and after interventions, we can drive meaningful insight. So, we want to see what it was like before and what it's like now and see if this change is being effective. And then we have intervention or practice change for patients. It would be routine mental health assessments will be conducted using validated tools like the DAS-21 and HADS. These are both mental health screenings that already exist in a hospital setting. Depending on the assessment results, patients will have access to mental health services, including counseling and mindfulness training. Nurses, on the other hand, will receive mental health support through various channels, including stress management workshops and access to psych counseling services. Previous research, also done by Huang et al., supports the efficacy of these strategies in enhancing nurse mental health and performance. And then for implementation, it can unfold over 6 months. It could be a year, but 6 months seems like a good range. And this month 1, the staff will undergo training in mental health assessment techniques and interventions. Month 2 to 3, you can see assessments for patients and nurses, beginning with interventions tailored based on those individual needs that we've gotten from the assessment techniques. Months 4 to 5, ongoing monitoring for both patients and nurse outcomes will be conducted, with adjustments made as necessary. Obviously adjust to what the patient needs the most, what the nurse needs the most. And then in month 6, comprehensive data collection and evaluation will be performed, assessing the overall impact of the intervention. So this is where that before and after kind of comes in. So for the methods, it can be qualitative and quantitative. For the patients, it will be the recovery metrics, mental health scores, satisfaction levels. We can analyze all that pre and post implementation. For the nurses, evaluation includes a burnout and job satisfaction assessment using established tools, which we already do have. So we can use those surveys to kind of show hopeful improvement, and the effects of the intervention will be measured through pre and post. And then data analysis, we're looking at statistical techniques, including paired tests, paired t-tests. They will be utilized to analyze the collected data. So that's qualitative feedback that we're looking to find with both patients and nurses that provide insight. And then ethical considerations, informed consent will have to be obtained from all the patients. The nurses as well we would like to have their informed consent behind all of this to ensure that there's confidentiality of their responses. Expected outcomes and implications. By focusing on mental health needs for patients, we will expect improvements in recovery times, better mental health status, and increased patient satisfaction. Addressing mental health holistically can lead to more effective patient care. We'll see reduced nurse burnout. The provision of mental health support is anticipated to lower burnout rates among nurses and enhance their job satisfaction. Such improvements are essential for fostering a sustainable workforce. A happier nurse can hopefully do a lot more for a patient. And then broader implications for nursing overall. It highlights the necessity of integrating mental health care into nursing practices. If successful, we're aiming to enhance patient care and nurse well-being with a focus on promoting a culture that prioritizes mental health, not just physical. So in conclusion, this evidence-based practice proposal is aiming to address the crucial issue of mental health in both patients and nurses. If we can implement targeted mental health interventions, this project aspires to enhance patient outcomes, reduce nurse burnout, and lead to improved healthcare quality overall. The anticipated findings could significantly contribute to the nursing field, emphasizing the integral role of mental health in fostering effective patient care and supporting nursing professionals. There's my references. Thank you.